2013 will mark the 35th anniversary of Whitman-Walker's founding and the 40th year of service by the Gay Men's STD Clinic. On behalf of the Board of Directors, Whitman-Walker employees, volunteers, patients, and community stakeholders of Whitman-Walker Health and the 54 community partners who have brought this event to you tonight, welcome. The last time Whitman-Walker brought the community together in this venue to talk about AIDS, we didn't have much to go on. In 1983, we did not know about HIV. There was no test. We did not have any treatment. There was no certainty about how the disease was spreading. All we did know was that there was a new and deadly disease called AIDS that was killing quickly and decimating our community. There was fear bordering on terror, and there was little hope. The path from those frightening days to now is an improbable path of fear and courage, anger and compassion, cowardice and steely resolve, ignorance and education, silence and death. But mostly, I think it is a path of love, hope, and extraordinary leadership in the face of the most critical public health challenge of our lifetime. Today, medical advances in testing and treatment have helped us to reduce death rates. They have had education and prevention campaigns that have helped make safer sex an open topic of discussion, and we've slowed the spread of the virus. In recent months, news of possible advances in treatment and prevention has prompted people to ask, is this the beginning of the end of AIDS? One of the things the panel will discuss tonight is whether our optimism is justified. The first AIDS Forum on April 4th, 1983, convened by Whitman-Walker, was the region's first public forum in response to the emerging pandemic. It was also the beginning of a promise to the community, a promise to bring high-quality care to people living with or at risk of HIV, a promise Whitman-Walker is proud to keep today. In the last 29 years, we have made tremendous advances in the fight against AIDS. Let us now renew our commitment to bringing this epidemic to an end and ensure that we will live to see a generation free from AIDS. Now, as I'm the Director of Development for Whitman-Walker, I hope that part of that renewed commitment will mean renewing the financial support to many of the AIDS service organizations which serve our community, including, of course, Whitman-Walker. We just could not do the work we do and provide the high-quality care we do without your support. Thank you very much. Ladies and gentlemen, now it's my honor to introduce a man who serves as an example of the extraordinary leadership I mentioned earlier. The Honorable Jim Graham first joined the board of Whitman-Walker in 1979. In 1981, he became president of the board, and within 3 years became executive director of what would become, at the height of the AIDS crisis, the nation's third largest AIDS service organization. In addition to the vital research and care Whitman-Walker provides today, it's important to note that in 1984, Jim Graham personally undertook legal aid counseling for people dying of AIDS to help them get their affairs in order. This one example, among way too many to list tonight, of Jim's personal leadership has grown to become the nationally recognized legal services program of Whitman-Walker Health, which has served tens of thousands of people and contributed to strengthening of the legal protections for people with HIV across the country over the past 3 decades. Ladies and gentlemen, it is my pleasure to introduce the Honorable Jim Graham.